The Niagara Health System is launching a new service to treat thrombosis, a condition responsible for 1 in 4 deaths worldwide.
Thrombosis is the formation of an abnormal blood clot, so a blood clot where we really don't need it. When we injure ourselves, when we start bleeding, we want blood clots there to stop the bleeding, physiological blood clots. But when you get blood clots in a normal blood vessel that is functioning, then it blocks the blood flow. It could be to the brain, so you get a stroke. It could be in a coronary artery, so you get a heart attack. It could be in the leg or the lungs, and most of those have the potential to kill the patient.
What is a thrombosis clinic?
A thrombosis clinic is a clinic that provides specialty care for patients who have a blood clot, basically. Could be anything from a blood clot in your leg, in your lung, all the way up to potentially somebody who has a blood clot in their one of the arteries in their heart or in their brain.
It can affect young patients, it can affect babies, even because when they have catheters in their veins or arteries, or if they have cancer, which unfortunately happens even to very young patients, then there is a high risk of thrombosis. But otherwise, it increases with age. So the older you get, the higher the risk.
And what kind of services will this clinic provide?
So we will be seeing patients as an outpatient. We will be seeing inpatients who have thrombosis, and any patient really that's got a thrombosis and has the need for that care, we'll be able to provide that.
How does this benefit patients?
So we're now going to be able to provide the care for patients here in Niagara, whereas previously they may have had to go to Hamilton for that level of care. So I think it's really centralizing their care where patients are sick so that they don't actually have to travel to get that care.
And what are your thoughts on seeing this brand new thrombosis clinic open up here in Niagara?
I think it is very important that this new clinic is opening up to provide consultations and advanced help to the other clinics that you have here in Niagara, the cardiac catheterization, the heart investigation unit, which also does percutaneous coronary interventions, putting stents into the coronary arteries. And in those cases, the treatment against blood clots can become very complicated because sometimes they have to be on several, 3 or even 4 blood thinners, and there's a delicate balance between preventing the clots in the stent, for instance, and avoiding bleeding, hemorrhage.
The new thrombosis service is located at the St. Catharines Hospital, and the NHS hopes to expand it throughout the region in the future. In St. Catharines, reporting for The Source, I'm Brendan Sylvia.